Okay, we are live now. I'll just share the link in the chat and on WhatsApp also.
Okay. Good afternoon, sir. Hi, Reiki, sir. Good afternoon. Can you hear me?
Yeah, I can hear you now. Hi.
Yes. Hi. How are you, sir?
Very well. Hi, ma'am. How are you? Sumati ma'am.
Hi, Ricky. How are you? Such a pleasant surprise that we meet here.
I am getting very low volume. Hold on. Let me just increase the volume. Yeah, nice to see you too.
Yeah.
You look the same.
Now, can you hear me clearly?
Okay, my volume was a little low here, so I just put that up
Oh.
slightly.
Okay. It's amazing.
You know how things change.
Good to know that.
Paula, Dr. Saptagirish is joining in 1 minute. He's just logging in.
Yes. That's great. That's great.
You have changed, Ricky. It's a long time since I saw you.
Face. Less hair.
No, those are all very physical.
Ah,
I'm more looking at your profile and all that,
my
So
profile is
much.
still the same. Yeah, optometrist from
We are all the
Shanti
same only basically. And then we add a lot of experience and everything, from that angle.
That's all thanks to you. You're the one who gave us a lot of interesting insights in those days. And I think we didn't realize it earlier, but later on you sort of start recollecting things that you've said, and they've actually guided us in when you sort of reach a fork. Those are the kind of people whose words come back to you, and surprisingly, yours have come back quite often.
Thank you. I am encouraged to keep working.
I think the biggest thing that was there was your openness and the way you allowed pretty much any questions to be asked up to a limit, of course. But the fact that you didn't, uh, I don't think too many teachers would have crossed that comfort zone like you did.
I'm comfortable only when people ask questions.
Because that's when you're actually getting to the bottom of things and figuring out what's going on, which normally people don't ask. They're actually uncomfortable questions, a lot of people.
True,
And
very true.
I don't think you were in that category, and that really helped us, I think.
Delighted to know that.
Have you been, Paula?
Good, sir. All good. Yeah.
What have you been doing?
Thank you for accepting the invitation. I know this topic is a little difficult. So yes, you are one of I think the best person to handle things.
Is Dr. Saptagiri online? No.
No, he has not yet joined. Yeah.
Okay, I thought Murli was joining in. That's what Lakshmi had
No,
told me.
actually, he has a family wedding, so he was like he will not be in a position to sit somewhere quiet and take the session. That is why he suggested Dr. Saptagiri's name. Yeah, he is also Sankara, but he is in Varanasi, UP.
Okay. He's what's his specialty?
He's an ophthalmologist. I mean,
Oculoplasty, oculoplasty,
okay,
and
oculoplasty.
Oculoplasty. Take it.
Yeah.
Right?
That's super specialty. Harshada, he's joining.
yeah. I had called him. He said he's logging in only.
How does one access the YouTube?
Uh, you have
Or
to have the app, I think. You have to.
no. When I'm posting it, people should know how to
Oh,
get in.
yeah, we can share the link, the live link we can share so that Harshada will send it to you.
Should catch up later, Ricky. Same number.
Did you say something other than catch up later? Something else you said?
Your same number.
Same number.
Mine also same number.
We should not share online.
Okay, so Harshada, shall we start? It's past 3.
I think we can start. Let him join, then we can. You can start with the introduction and all. Yeah.
Yeah, yes, yeah. Because it's past 3, so I'll start the formal introduction. Yeah. Okay. So, good afternoon, everyone, and a very warm welcome to today's webinar on whom to visit when, understanding the eye care pathways. Eye problems can be confusing. Should you see an optometrist, an ophthalmologist, visit a clinic, or go directly to a hospital? This session is designed to simplify the eye care journey by helping you understand the roles of different eye care professionals and the right time to consult each of them. Through expert insights and practical examples, we hope to empower you to make informed decisions for your eye health and ensure timely and appropriate care for yourself and your family. It is my pleasure to introduce our esteemed panelists for today's discussion. We are joined by a distinguished group of experts who represent different points along the eye care journey and bring rich clinical and community experience. The experts today bring diverse perspectives from clinical care, leadership, personal development, thus making this discussion truly holistic. We welcome Dr. Sumati Narayanan, a Platinum Master NLP trainer, counselor, and life coach. With her vast experience in guiding individuals towards better well being and decision making, she will help us understand the human and behavioral aspects behind eye care choices and common myths. We will soon be joined by Dr. Saptagirish R. He is the Dean, Sankara Academy of Vision and CMO, RJ Sankara Eye Hospital, Varanasi, Uttar Pradesh. He is a leader in ophthalmology education and clinical care. He will share insights on early detection, management, and the crucial role of ophthalmologists in the eye care pathway. And we are honored to have Mr. P.S. Rekhi, founder and consultant optometrist, Spectrum Eye Care, Chennai. A veteran in the optometry profession, Mr. Rekhi brings decades of experience in patient care and practice development, offering valuable guidance on navigating eye care services effectively. We are grateful to all our panelists for sparing their valuable time and being with us today, and we look forward to an engaging and informative discussion. Welcome all. Before we begin with individual questions, I would like to hear from each of our experts to both Dr. Sumati and Mr. Preeti. Um, Based on your experience, how do people usually think about eye health and eye care? What do you see in terms of awareness, habits, or common misunderstanding? I think we'll take a small break and welcome Dr. Saptagirish. Hello, doctor.
Hello, hi.
Hi, good afternoon. Thank you for
Good
joining us,
afternoon.
doctor. Yeah, we just finished the introduction and thank you so much for sparing your
Yeah, I'm
valuable
sorry.
time.
Yeah, I just got to the line. I mean, small
Yeah.
net connectivity issues. That's why.
No problem. So, doctor, before starting with the individual questions to you as experts, I would like each of you to give an opening remark. So, the question to all three of you is, based on your experience, how do people usually think about eye health and eye care? What do you see in terms of awareness, habits, or common misunderstandings? So maybe, 2 minutes each of you as an opening remark, and then we will straight away dive into the individual questions. So yeah, anyone who wants to start.
We should go age seniority wise. Subhati, would you like to start this?
I would like you both to start so that we have the context, and then I will join. That will be appropriate. Age is just a number.
Something, Girish. Would you like to start, sir, on this one? Your experience is quite vast.
Sure. I'll just try my video because in case there's a disruption in the network, I may have to turn off the video. Is it okay
Sure.
if I have the videos off? Because
Yes,
let
please,
me
sir.
try.
The
Let me
connectivity is
try.
important. Yes. Yeah.
Yeah, is it okay now? Because
Yes, we can hear you.
okay, fine. Yeah, I'm
Please
with the
go.
video. Yeah. Yeah, thank you. Thank you very much. My observation regarding you wanted to know about patients' response to the eye diseases and why they come and why they do not come, right? Right. See, we see a lot of spectrum where patients come in both that they come quite early, and also we see spectrum where they don't come early. Uh, it depends on how and which part of the area they are belonging from. Generally, what we see is patients who come from the rural areas, they come quite late for their eye problems, whether it is glaucoma or whether it is refractive errors or even tumors, they come very late. And sometimes it so happens that even though they're aware of the problems, they keep going to a no, to a general practitioner or whoever the local doctor is available there, who might not be an ophthalmologist or an optometrist or whoever it is. And then they said, okay, fine, you're just having little tearing. They even see a quack most of the times. And then that problem is deferred. And only when it goes beyond a certain control that they refer to actually an ophthalmologist or something. And that's when things are out of control. Whereas the opposite happens in most patients who come from the cities. They're quite aware of what the problem is. They Google everything, the small issues, they're able to search out. So they're on the opposite extreme side of problems. So we see the entire spectrum over here. I'm practicing in Shankara Hospital in Varanasi. So we see the entire spectrum of patients, those who come in late, so those who come in too early. And that's the way. I mean, but more importantly, what I feel is that uh, patients are aware of most of their problems. They are aware that there's something wrong. It's just that they're not able to access the correct specialist or the correct person who can actually guide them according to what their need is.
So,
I think I completely agree with what Doc is saying because I've been practicing in a urban city since 1991, and I think those days routine eye care was not that frequently done. But yes, today we are beginning to see a lot more people taking care of children's eyes below the age of 5 and routine examinations, camps happening. And of course, people above a certain age, a lot of them are actually looking after their eyes. And I think Google has been a big help and a pain because sometimes they sort of overdiagnose things and start coming in. But I think it's in one way that's better, but because at least they ask for care rather than wait for something to go wrong and then you sort things out. Uh, the other part that I do see also is with the usage of online increasingly, just as an example, there is a negative side to it also because we are increasingly seeing simple things like people buying a contact lens off the shelf and using YouTube to teach your kids how to put it on and off, and then complications start coming. And then they call you and say, no, my eyes are red, or this has happened, or that has happened. It's, who prescribed the lenses, who taught you how to put it on and off and stuff like that. So that's the negative side of it because people begin to start seeing it as a off the shelf device. And when it comes to primary eye care, I think we are much better than we were 35 years ago, thanks to awareness being spread by lot of organizations. So I think we're in a better position than we were years ago.
I would say that vision care is something that a common man today, if they can afford it, they are very fast in taking response or the action for it to help. I'm also looking at it from the preventive angle. Today, it is not only when people have problems, but when people are using a lot of screen time, both online for work, for studies, and for children for playing games. The screen time has increased multifold. And as a result, there is one set of parents who are careful to give the child a glass which will help them not get the glare or not get the ray, not the effect from the screen. And so that those kind of glasses are also becoming on they as Reiki said, they just go to the net and check and then they buy and then they whether the child needs it or not on a preventive mode, they put it with a lot of awareness. It's not like it is just blindly done it. And there is also a trend that we what I'm there is a lot of ignorance about issues. Like for very young children, parents may not even be aware that a squint is not natural. A squint is something that has to be addressed, for example. Or the child has some problem which the child cannot express because the child thinks this is fine, this is what is normal. Child doesn't have an idea of norm also. So the awareness about among parents to look for signs which indicate that there could be a vision problem is not much, even among the educated. I'm only keeping my observation to this city life because in the rural area, it is a luxury because they don't have access to hospitals, access to vision care professionals. And so one of the efforts that some of the very good hospitals have taken is they do online and video call and all that to help people in rural area who cannot travel all the way and come to a city for vision care. So a lot of work is being done, but a lot of work has to be done. And I will say unless we take a very strong step in order for us to help people realize how important it is to take care of the eyes, which they are unknowingly abusing, and in the name of justification, what else we can do, and things like that. I think the awareness has to increase country-wise because everywhere now everybody is learning even online. So it's not just the urban, but also the rural population who need to be told that this is a very important thing.
Thank you. Thank you so much for your remarks. So, in continuation to what Dr. Sumati you just mentioned, so diving a little more deeper, ma'am, what do you find like, or what do you think that why do people ignore eye symptoms? Is it like fear or denial or procrastination? If you can, maybe explain a little more for the general, notion what usually people think about.
There are
What is this?
two approaches. One is they don't know. They don't know that there is a problem. This is for children, not for adults. And for adults, the usual thing, maybe it'll go away. I'm seeing something blur past 2 days and they think it'll go away. Maybe I put some soap in my eyes. And so ignorance is the biggest problem. Not that people say, okay, I have an eye problem, but I'm not going to see a doctor. but definitely they need to. And what they don't realize is the more you delay, the more severe the problem becomes. So to prevent that from happening, people need to be aware. At different stages, the needs are different. For example, a child going to preschool, first time school, etc., or a school going child complains of a headache. Sometimes the parents say you're just giving an excuse not to study, so now just go play or something like that. And then they may ignore the child's sharing of, I'm feeling uncomfortable in the classroom, I'm taking time to write. Instead of probing, they don't understand the child can only express that much. So we need to probe and find out, go to the class and find out where the child is sitting and things like that. So this is for the school going children, I'm saying. And very young children, of course, the parents don't know conditions where the child has, as I said, squint or blurred vision or high power. And only when the child responds verbally, they will know the child is able to see or not. So this is one segment. Another is when people have conditions. Today, a lot of our population have diabetes. We are not able to see that every year vision check is very important, and because it's a preventable disease that comes along with the diabetes package. So then the awareness is not there, and nowadays what happens is in all these packages they include the vision check, so that they are compelled to check their eyes wherever they go for a full checkup, etc., like in some of the premier hospitals. But if we do not take this seriously and then we delay for some reason, the condition becomes severe. So among the other conditions that are there in health for the middle age or for the slightly senior people, this is a very important one. And when we look at very senior people, if depending upon their economic level, like if they have money, then they will go buy the glass and all that. And today, glasses are not, eye spectacles are not just spectacles, they are a statement. You know what I'm wearing? I'm wearing this, I'm wearing that, branded. And if we do not, the impression is the higher we pay for the glasses, for the spectacles, the frames, etc., the more you can make a powerful statement. I have been Reiki's customer for many years, and he can very well understand where I'm getting exposed to these brands, etc., because we did not know there are international brands in the common, but a common man should not get the feeling that if I don't have that brand, I'm not getting a good pair of spectacles. That should not be there. So elderly, they are poor, they are uneducated, and they do not have the means or the way to go to a hospital. Their vision is affected, and they come at the last stage, as Dr. Saptadvi was saying. People go to the advanced level and then come for treatment at that point where they have to be helped even more than what could have been prevented. So prevention is an area where we haven't focused as a country. We're going on the curative line, not on the preventive line. So why people don't do because of ignorance, because of not able to access vision care expert at different levels. I have also seen hospitals where people are trained to just identify the problem and send them to the hospital, because at the grassroots level, that's all could be done. But now with a lot of technology, I think it is changing. And people avoid not because they want to hurt themselves or because they don't care, but because of not knowing or not being able to, even though they know. Sometimes in a hierarchy of needs in a family, an elderly person's vision check is postponed and it is given not much of importance or priority, depending upon what status they have in the family. That is only if they are in a joint family. Otherwise, it is their own care that they have to do it. Elderly have one more problem, which is someone has to take them, someone has to accompany them. That also becomes a reason for stop.
Great. So, coming to Reiki, sir. So, where does an optometrist fit into the eye care system? And when do someone, seek optometry care? If you can put some light on that.
Okay, sir. There are two ways to answer this question. One is what is currently happening and what I would like for the situation to be. And in some places, quite a few of us who've been start practicing for a while, we have actually reached that status. And I think your primary, anything wrong with your eye, unless of course your eye is bleeding out and you've hurt yourself and met with an accident and you complete loss of vision, I would still say that the primary place to go to would be an optometrist who's got the necessary skills to do a complete eye examination, not just a refraction. And I think institutes like Chakkanetrale, LVP, Shankara, the advantage of going to an institute like that is that if you happen to meet somebody who's, let's say, a retina specialist, but your problem is uveitis, you'll be sent to the appropriate doctor. Whereas in the private sector, that does not happen with ophthalmology. Quite often, it's one general ophthalmologist who handles glaucoma to cataract to uveitis to everything. And yes, if it crosses beyond a point, certainly there are referrals that do take place. The advantage of going to an optometrist, and I think this is the biggest advantage of going to an optometrist, is like a person like me, my entire practice depends on the quality of my referrals. So if you come to me with a particular problem, and I would identify it as such, and my referral to a particular subdivision of ophthalmology, not, let's say, for example, a person comes with pre-proliferative diabetic retinopathy. If I just send to a general ophthalmologist, I don't think I'm doing my job. I think I need to send to a medical retina specialist. And in this, what happens is that one is the patient gets better care, pretty much the same as you would in an institute. Second is that they do come back to you for further referrals in the future. So it's great for your practice, it's great patient care. So I would still feel that for a primary eye care situation, an optometrist should be your first stepping stone. And then we should be trained well enough to recognize at what point is referral necessary and to which branch in an ophthalmology circle is it necessary, and guide the patient in the process and in the post-op phase. This is where I think we would be quite useful. And I think to a large extent, my practice has achieved this in the last 35 years. We do guide patients through surgeries, post-operative care. Even when things go wrong, we are there to hold their hands and guide them into the next step and counsel them, because a lot of ophthals don't really have the kind of time to spend counseling a patient. And I think that's where our role becomes a lot stronger.
Right, right. So, in continuation to what Preeti sir said, I would come to Dr. Saptagirish. Sir, what is your opinion for the public? When should an optometrist, say, also public, is visiting the optometry clinic, and what do you feel an optometrist should refer to an ophthalmologist? When should that happen?
Yeah, see, that all depends on a lot of factors as to when an optometrist should refer to the ophthalmologist. It depends on, number one, their competency and what all they're able to actually diagnose. See, what happens is, once you graduate and all that, and you've seen some amount of ego will also come into your play. You said, I've seen this, I know what it is. Yeah, that is fine. But then what happens is when it goes beyond a certain amount of care, it's better you refer. Like, it's a patient with glaucoma. Let's say you see pressures are high. You refer it to the glaucoma specialist, as Mr. Preeti mentioned. You know that person. You send that person to that specialized care rather than send to a general ophthalmologist who will again want to investigate. See, it's a private practice for him, right? And he will definitely not want to lose a patient out. And that makes sense. There's nothing wrong in it. But you lose time. The patient loses time. So in which case, if you refer to a glaucoma specialist when you suspect that the patient has glaucoma, it makes much more sense. So likewise, an optometrist should be able to find these small changes, not only through education, but through experience, and also by talking to other optometrists and attending other CMEs. You understand that these small nuances should be picked up. The earlier you pick it up, the earlier you refer, the better it is for the patient. Right? Even small things like a small epithelial defect, corneal epithelial defect, right? Fine, you may give a small lubricant, you may give a lubricant for some time, but what if it's not resolving in, let's say, 48 hours? No, that's a red flag. So, and you should also know which epithelial defect will not heal with just a lubricant or an antibiotic eye drop. Right? Sometimes it may be very difficult, like early viral keratitis or early viral corneal ulcers. They look just like a small epithelial defect, but they need much more intensive medication. So whenever things look away from the normal, right? When they don't look like what is supposed to look normal, please refer them. Please send them out of your care to someone who you think can do a better job. It can even be a very senior optometrist also, because very senior optometrists have seen that spectrum of disease, so they'll be able to manage it. So that's what I feel would be the ideal way to go about. And of course, that's the way they go about even in US and other countries where the optometrist is trained to find out these small problems and refer them accordingly to the ophthalmologist.
Right, great. Thank you. Thank you for the
Add
opinion.
something to what Doc was saying. I think he made a very valid point about the core competencies of an optometrist. And I think also for you to realize at what level you are at. Like he said, if you're an inexperienced optometrist, realize that your experience is less and limit yourself to, the slightest doubt. It's better to refer than to try and hold on. And I think I completely agree with him on that point of view. That you have to realize what your inadequacies are before you decide to hold on to a patient. That's completely incorrect.
Yes.
I,
Yes,
I
and
would I
it,
like to add one point. I have a question here to both of them. I have
yeah.
been a communication teacher for optometry students ever since the batch started in Netherlands in the 80s, mid 80s. One of the angst that we have is the people don't know who an optometrist is. People think if it is a vision problem, they have to go to an eye doctor. Some of them don't know to pronounce ophthalmologist, but when we say the first point of consultation can be an optometrist, I have not seen awareness among people to say, or some assistant checked. So their visibility and the existence of optometrist as a major contributor for vision care profession is not being acknowledged or given the due visibility because people don't know who an optometrist is. They know an optician because shops are there, but they don't know who an optometrist is. That is an area where I want some more information about what is being done in our country. Like Dr. Saptarshi was saying, they will go to abroad, they will go to an optometrist straight away. That is not happening here. This is my observation. Maybe I'm wrong, or maybe I am biased. Because I'm not, when I talk to others, and I'll tell them first an optometrist will say, who is an optometrist? Then what did you say? So when I train people, I say optometrist properly because they don't know the words. The people are patients, don't introduce yourself properly. So what is being done in our country to make the presence and the contribution, the support of the optometrist to an ophthalmologist in order to enrich the patient's experience, theoretic experience?
Reiki, sir.
Paula, you're better qualified to answer this question because that's what OCI is trying to achieve. So I
Yes,
think you
and today's session is aimed towards that. So thank you, Sumati ma'am, for bringing up this question. Yes, so I think Reiki sir would agree, even Dr. Saptagirish would agree that uh, you know uh, sir is almost 35 years into this profession, and from where it was to now how it is, the awareness has definitely increased. But again, it is mostly in the metros where people have access, and but in rural or semi-urban, it is still the narrative is the same, that it's first an assistant and then an ophthalmologist. So I feel that we need to create more and more awareness, and we need to talk about the profession. So what so I mean, I'm also about 20 years old into this profession now. So what I also say, and we keep repeating it to students, that introduce yourself whenever you're meeting a patient for the first time. Introduce yourself with your name and your that you are an optometrist. That is how I think people will start getting familiar with the term optometrist. And then because I'm sure most of the people who come with an eye care problem, at some point of the time they meet an optometrist, but it is the optometrist's part that they have to keep reiterating their professional standpoint and saying that yes, I am an optometrist, or introduce themselves. Then only the term will get popularized. uh, Open to comments. Yeah.
Yeah, just a few words. Yeah, in my practice of ophthalmology, what I've seen is the initial days when in Shankar Netralaya, the earlier days. So when I joined ophthalmology, as Madam said, optometrist was a new word for me. Okay, but yeah, we got to learn very fast in Netralaya. Within the first week, I knew that they were the bosses for every first year who would join as a doctor. And our first point of contact was actually optometrist rather than the ophthalmologist. Even our senior colleagues would tell, go and see the optometrist first. And mostly what happens is ideally, every ophthalmologist, when they join the ophthalmology course, should actually go to the optometry. So most colleges do that, like Shankaracharya does it, Shankara does it, LVP does it. LVP now, when they had the DNB program, they were doing that. So they go through the optometry, they learn through the refraction, the contact lenses, the other fields, everything, and then they come into ophthalmology. So that is how the gateway to ophthalmology was opened up. Now, regarding the patient's awareness about optometry, yes, I agree with Sumati ma'am that it is still very poor in the country. Yes, big metros, Cosmos, they know what an optometrist is. Patients will walk in when they see that name and they want to go and meet an optometrist. But in tier two cities, three cities, most of the optometrists, you'll notice when you come to smaller cities that they write their name as Doctor so and so. So it's understandable because patients relate only to that, right? But when you ask them, they'll say, no, I'm not a doctor, I'm an optometrist, but you have to write because they don't understand, right? So there may be legal implications. That's a different thing. That's a different debate altogether. But at least they're able to send the patients accordingly. So I've moved to Varanasi about a year back from Bangalore. So I see this trend where I get a referral from particular doctors. I don't know whether they're doctors, but when you call them back, they say, no, we are optometrists. And we send the patient to you thinking that patient will get better care. And they said that we are not optometrists, but we'll try doctor, otherwise patients will not come to us. Because they don't know. It's not that, see, they have no idea. So it will take still some more time when people will be aware that an optometrist is the person who's the first point of contact, who will do it for you and then send you to the right ophthalmologist. So that will still take some time till it percolates to all the tier two, tier three cities when people will be aware. But let me tell you one thing, that in spite of no, not ophthalmologists being there in all the districts everywhere around what I see around here, the optometrists are doing actually a fantastic job. They're there in the remote areas. They're the first point of contact for most patients with eye problems. Even though they write themselves as doctors, they send them. They give them some care. No, patients are having some problem. They at least give them an antibiotic and tell them you go and see an ophthalmologist. So things like that, some primary care is still happening in those areas where nothing is there. In cities, it's a different ball game altogether. In like let's say like Kolkata or Delhi, Chennai, Bangalore, Mumbai, it's a different ball game where optometrists are actually known. They're doing specialized work. In Mumbai, optometrists are doing very specialized work. Hyderabad also. So there it is different. People know that he's an optometrist. I need to go to them for whatever it is. So it will take time. I guess, ma'am, that should only properly answer madam's question, that time is the only one that will tell us. See, it took us maybe 25, 30 years for optometry to be recognized as a study course per se. Maybe in another 10 years' time, we'll come to a situation where people will actually want to first see an optometrist and then an ophthalmologist.
Reiki sir, you want to add something?
Pleased to hear docs
Yes.
stories about what's happening with referrals, etc. And it's a interesting thing that if you're an optometrist, nobody will come to you. But if you put the acronym or the prefix of doctor, then people do come to you. So it's an area I'm completely unexposed to. But yes, I completely agree with him. The kind of I think also people like us who are outside who have managed to make a name for optometry, our own patients start referring others to us and spreading the word about optometry. And when they go to a different city, they tell their friends, "This is the kind of person you should meet," and so on and so forth. I think it's all going to be word of mouth, and I do believe there are people working with the government right now to try and get optometry recognized even further as a profession. And I think once that starts happening, there's going to be a sort of it's like a snowballing effect. Things are going to pick up space, and hopefully, like he said, in 10 years we have uh, better things happening.
Yes. Yes. Hoping for the best. Okay. Harshada, did we lose Dr. Sumati?
Yeah, I think I'll just call her up 1 second.
Okay. So, we'll, shall I wait or? Yeah, she's back. Yeah. Okay. Sumati ma'am. Yeah, yes. So the next question is to you, Sumati ma'am. So what are your thoughts on the behavioral pattern? Basically, for example, buying glasses without an eye examination, just, going and telling that, okay, I need this power, you give me a makeshift glasses. Or, believes like an eye drop can fix everything. So, just going and getting an over-the-counter drop and applying without even seeing a specialist. So what are your thoughts on the behavioral pattern of, people? If you can throw some light on that, yeah.
People have a tendency to think that I make the issue bigger when I go to a doctor, whether it is a fever or a vision problem. Some people who have the tendency only will go to a optician and say, I want these glasses. And the first question they will ask you, where is your prescription? So the the network that we have, they would ask who gave you this prescription. So we are living in on the one end of the spectrum. We have people who go um, for a very sophisticated kerato. What is the treatment? Kerato keratitis.
Really, that is ancient history.
No, when they go in and reduce the power for that.
Yeah, orthokeratology, yes.
So that whatever name it is, when I came to know someone with a power of 2 - 2 has gone for the treatment, I was shocked. I said, and they spent 2.5 lakhs for that. On the one hand, we have people who are thinking of their vision problem like that, and then on the other hand, we have people who think if I just keep quiet, it will become alright. That is out of ignorance and indifference towards one's own health. I think if we look at it seriously, no one in the right senses can ever go and order themselves a glass like a Saradon or a Dolo 650. No, it is very dangerous to do that because they may have an inappropriate lens which will actually precipitate newer problems, and they won't even have the experience to connect the two and say, because I bought those glasses, I'm having this problem. There is no direct connectivity, but there is an impact on the system when we have a wrong glasses on the face. So my opinion is people need to be educated to get it appropriately diagnosed and then only go for the lenses and spectacles. Otherwise, it is not a healthy one.
Right.
I think the percentage of people who are doing that is coming down.
Yes, right. So in continuation with that, Reki sir, I'll come to you. What are your thoughts on comprehensive eye examination and just power checking?
I think my viewpoint that is very, very clear. There is no such thing as a power checking without a comprehensive examination. You cannot do a prescription unless you've done a complete, right up to the point to checking pressures and doing the fundus examination. You cannot give a prescription. And just to add something to what Sumati said, I'm not too sure whether the number of people getting glasses without prescriptions is going down or going up. I think it's pretty much the same, maybe even going up, because especially above the age of 40, a lot of people just buy an over-the-counter plus one and start surviving with it. So there are many times you see a person with a plus three. In the last 4 years, he's been wearing a plus one, and now he drives with it. Least realizing that that's no longer a reading glass, it's now a distance glass. And of course, he can read better with it. So I honestly don't really care whether a person is happy doing that, but he should be made aware. We don't just check for plus one when we are above 40 or your reading powers. You're checking more for glaucoma, checking for early ARMD, checking for a lot of other issues which are there above the age of 40. And those are the things that they have to be made aware of.
Right. So, Dr. Saptagirish, when someone should see an eye surgeon, what are the eye conditions that require medical or surgical treatment rather than the routine eye care? If you can just throw some light on that.
Well, no, on a lighter note, there's nothing called a normal eye. We all know that. You can always give a minus or plus 0.25 prescription too. The same thing goes with other eye conditions too. There's nothing like a normal eye. The patient is having a problem, you can always find a condition. But seriously speaking, actually, not all conditions do require a lot of intervention, actually speaking. We know that, right? No, patient is having a 0.25 refraction. We know that most of the time we don't have to give a prescription. So something like that on similar lines. Uh, well, an annual eye checkup is mandatory because sometimes there'll be conditions which you will not realize. Starting from dryness, of course, there will be complaints, but otherwise, like, keratoconus, starting from keratoconus to pressure changes in the eye to changes in the retina, things like that. So an annual checkup is mandatory because once it is evaluated, all the segments, as Mr. Riki mentioned, you're aware of small conditions that can be picked up early, and then treatment becomes easier or intervention becomes easier, other than when you come late, when things have gone out of control or you're looking at salvage rather than treatment. So, yeah, and what are the red flag signs? I think most optometrists and ophthalmologists know what the red flag signs are of any condition in the eye. And I think we're pretty good at that, actually speaking. Nowadays we don't, people are able to identify conditions much faster, better, and everybody has they have access to AI, Google, and you have such wonderful medical AI softwares. They tell you what your problem is and where you should go actually. So, and it is getting better. Nowadays patients, they come, they say that I want to see the glaucoma specialist, I want to see the cornea specialist, I want to see an oculoplastic surgeon because I know this is what my problem is and only that person can treat it. So we are seeing that happening uh, everywhere, irrespective of which type of city it is or where it is. People are now, and they will come with the AI platform and they say that this is what AI has told me, and I think this is what it is. It may sound a little too much because patient is coming with his own treatment, but sometimes they're all necessary evils, so they actually help them sometimes. So everything has a good and a bad point, the way we look at it. So they have their benefits. When they come early, they realize they come to help, it's fine. But when they come with their own treatment, then that's where the problem arises.
So coming back to Reiki, sir, what are the common eye conditions that can be managed with spectacles, contact lenses, or vision therapy by an optometrist? So we have talked about the eye care conditions which are an ophthalmology specific. So now talking about optometry specific, if you can share some insights on that.
Starting from bottom up, the easiest is vision correction using glasses and contact lenses. Um, Anisometropia correction, which is basically a binocular vision issue when you wear glasses, to giving them contact lenses. Myopia correction is currently the thing that is going on. Of course, you've got vision therapy. You've got specialized contact lenses for keratoconus, for surface defects, surgeries which have gone wrong, where the corneas are compromised, giving them scleral lenses. So these are where you start getting into more and more specialized care. And of course, there are emerging branches also coming out now, which is uh, like neurooptometry, where you're dealing with TBIs and MTBIs and getting patients to actually walk better, feel more comfortable, have more confidence, not to get dizzy, using VOR exercises to help a patient to get better balance, using the eyes, ears. So these are all areas which are nascent, but I think there are a few of us who are practicing this, and it's extremely, uh, how do I say it? It actually gives you a lot of satisfaction when you sort of help a person out who's, in a dizzy world the whole time and you help them feel a little bit better. The other part that I would look at is where, and this is a point I would actually like to highlight, is where I think optometry probably is better than a corporate uh, eye care setup. Is in a corporate eye care setup, the ophthalmologist quite most often receives the patient after the vision check, the basic examination has been done, and he's dilated and he comes there. So, just as an example, about a month ago, we had two interesting cases. Both were neurological cases. And the only reason we actually picked up the case was because I do the entire examination myself. So, on paper, the vision was 6.6 and 6.6 minus 2, which is not bad for a 40-year-old, right? But it's the speed that the patient read with. which was hesitating and slow, which actually prompted me to do further tests. And then we finally, one patient found two infarcts in the brain, and another patient had um, we still don't know whether it's TB because I think the treatment given was slightly incorrect. It was either TB in the cortex or cysticercosis. It was a very nascent thing. The point is, what picked it up was the fact, and I know for a fact that if this had gone to an institute, the patient would be saying, I'm not seeing too well, but the doc says, oh, this is 6/6. And if the symptoms are not too bad, you just say, okay, just go ahead. Or perhaps we would have gone for further testing. But the fact is that I think that's where also optometrists can learn that when a patient reads slowly, maybe you should make a comment saying that he's got 6/6, but reading slowly. So that's information to the ophthalmologist who's not actually seeing what is happening. So I think that's where I think in picking up conditions, we do definitely have that advantage. And I think that should be taught to optometrists to make these notes.
Right. Thank you so much. So, Dr. Sumati, I agree that we just discussed about the lack of awareness or access, or sometimes ignorance, which uh, are the kind of factors which prevent people from maybe going to seek eye care. But are there any other stigmas you would like to highlight which delays care?
I would say this, the stigma is not so much now as it was before. Like, because if a person, if you ask the teenagers or the children, they would say wearing the glass makes you nerdy. And even some adults believe that. But if you wear the glasses, you become nerdy, you become like serious and all that. And one school of thought is I look more like an intellectual, so unapproachable. These are some of the impressions that people have. I wouldn't say it's a stigma, but among the students, two, three things happen. School students cannot go for games because of wearing glasses, which could make them vulnerable. Or they'll be denied that chance because of the vulnerability. But now we have acrylic glasses and all that. Now I think there are many other ways of helping the student play. And today with the variety of glasses, like glasses that we have, for example, the entire pediatric section has the latest cartoon characters as the frames, and then those kind of things make it very interesting for children to go towards it. And recently, I had seen a case of a child who was diagnosed with squint, a 4-year-old, and the mother, and they thought it is a runs in the family because the father has it, grandmother has it, and so that nothing needs to be done about it. We didn't do anything about it. So what is there to do about it? And I intervened and I gave them a little bit of info to say, go and check that it is only that and nothing else, nothing can be done. Just check it out. And then they were educated, and then they were made aware of the condition, and then they had to do the strengthening exercise with losing one eye. And then when I explored, there was this one eye black thing that's available in Amazon, and so it became a big humorous thing in the family that this child wore and everybody else wore for company's sake. So today, these products are available in the field to make the treatment possible, to make the correction, rehabilitation possible in an interesting way. And so there is a lot of work being done, but then the other, so that way, if from being a, see, I only have this, you don't have it. That becomes the other reversal. And this is for the children or the teenagers. But today it is like when even if they don't need a glass, they would wear in order to get a certain look. So, and if you go to any of the online services, they will even diagnose and then they will show you how you look with different frames. So all that, those things are technology enabled on the one hand. On the other hand, we have people who can't afford it. So in our country, we have contrasts. So my only stake is, see, the professionals also, the young as inexperienced optometrists are taught to see about the eye and the conditions in the eye. But the mind before it, behind it, like the head holding it and the mind attached to that head and the body, that is not being sensitized to. So the optometrist and the service provider has to be sensitive to the person, even though the entry point is the eye. And we all need to remember eye is a window of the whole world, and the person cannot see a lot of loss happens. So then the eye and the care of the eye is very important, and the person behind it, their mind about it, what is their hesitation, etc., need to be individually addressed. It is not a generic thing that everybody will feel this way, etc. It depends upon how we present it, how we project it. Would you like to do this? Would you like to wear and look smart? Something. So, how do we present the need for wearing glasses, the need for any of the processes that need to be done in order to correct the situation? Those kind of things, very, very important, has to be communicated properly and communicated in a way that it becomes hopeful for the parents, especially in conditions which are quite severe in very small children, where the parents or the mother has to be educated how to take care of the vision of the child. So stigma wise, those for wearing glasses, perhaps it is still rudimentary. That I'm not seeing when the boys say it, especially, they get teased, they get bullied. A soda bully is what they call the child who has wear glasses. They give him nicknames. And so that sticks for them the lifelong. So that becomes a deterrent factor. But then today, with a lot of interventions from many people, now that is not happening. And so we perhaps at the decision point, the optometrist or the ophthalmologist can guide the parent as to how they need to help the child accept the glasses, or even for an adult to wear glasses. Surprisingly, even after a cataract, some people think after that I don't need glasses. The professionals who have um, informed them about before taking a decision, perhaps this person didn't understand or whatever. She was so disappointed that she had to wear the reading glass. So she had taken mono focus, and then she had to wear glasses. She said, I went for cataract only to stop wearing glasses. Now they're telling me I had to wear for reading. It took me half an hour to talk to her, to tell her that half an hour, how many hours do you read in a day? 1 or 2 hours. The rest, you don't need glasses. Don't think of it like that. Took me half an hour to talk to her. Only because she was known to me, I did it. I don't know how it is being handled in other places where I thought I won't have this and now I have to bear this. So that becomes a thing. And also if any severe problem like uveitis or anything happens, the aftercare and the continuation or the follow-up of what is being done needs to be diligently done. Those are the things that are more important than worrying whether my glasses will make me look not good. So today we have that though in those days the frames were very few, but now you have a variety of mind-boggling choices we have, and so it's an interesting game actually. I can wear this, I can wear that. That kind of a thing happens when you decide on the classes.
Right. So coming to Dr. Saptagirish, sir, why is it important
Paula,
to
if we
have?
just, if I may just intervene,
Yeah.
I just want to say
Yes, yes,
something
please, please,
after
please.
after Ms. Dr. Sumati's comment. Yeah, I very much agree that there's a lot of psyche that plays when somebody's wearing a glass. Um, yeah, so especially after cataract surgeries, when all the entire Pandora's box opens up, and they start saying that I paid so much for a surgery, and you said you not give me a lens, but now I find that I see better with a lens, and depend on lens. So there's a lot of thing that goes on in our mind when after a patients undergo surgery and then they have to wear lenses. See, a lot of things is that the society surrounding areas in which they stay, 1 or 2 persons would have had a mild myopia to say per se by itself. And post cataract surgery, the need for glasses for near or even for intermediate or even to a fair amount of distance would have got negated. So they become like a poster boy, and they start saying that no, I got my cataract, I don't wear glasses at all. And that is what percolates across. And then the neighbor gets the surgery done, and they say, no, my neighbor, no, that person said you don't need to wear glasses. He's able to read everything. Why am I also posted
Yes.
surgery or what, or the lens is wrong, or what is it? You're not counseled right. That's when it opens up the entire gamut of problems. So awareness about cataract, I mean, need for wearing glasses is very, very important. And of course, you have a lot of frames. You have such nice frames now. You have 3D wraparound frames, wraparound lenses. Everything is available in the country now. But it's that mindset which is there, which is very, very important, which needs to change. It'll take time, and even in most advanced countries where they've been doing all these cutting edge technologies and all, India is nowhere less than that. still the patients still have the same mindset. They come, they say, no, I was told I'll not wear, and you don't I don't need to wear glasses. Now at the end of the day, you say I have to wear glasses. So I have seen this happening even in US, UK, everywhere. I've seen the same story getting repeated. I think we have to just accept it. I mean, there's nothing that much. And even if you take consent, even if you have a video consent, everything is done, still that they'll come and say, no, I'm still quite unhappy.
Yes. Yeah. So, continue with sir. As I was asking, why is it important to have a proper referral pathway, and how does delay in arrival makes the treatment difficult from your perspective?
See, a referral pathway is important. What happens is you cannot be too dogmatic about many things. When you try to make anything a law or a rule, there'll be ways to break it. And things will be broken for whatever reason it is. So the referral should come from the optometrist or ophthalmologist to a higher center. It should come from within. If I make a rule that you have to send, people will break it. So it should come from within, that I will do better for this patient. It's beyond me, I cannot do it, so send it away. Things like that. Now, whenever you delay any referral, yeah, it is difficult because the disease is much more advanced. Let's say you have a patient with retinoblastomas. There's a slight white reflex, and you've just taken a casual examination, you've not examined, and you just left it and said, okay, no, small refractive error, only small child does these things. Or you sent it to somebody who does not know anything about retinoblastomas or anything like that. Small child with early cataracts, you're not sure what it is. Just say, okay, fine, I'll do something about it. You wait, let the child grow up, then I'll handle it. They'll be better off that way. So things like that. No, then when they come back to you after, let's say, a certain period of time, you lost it. So it's very difficult to convince the parents that, and then again making the loose statements that, oh, you came to my clinic too late. Had you come 1 year earlier, I could have done miracles. They sound very dramatic, very filmy, but they actually downgrade your entire profession and your colleagues. So I think those should not be there. It's difficult, but I know they should not be there. But yeah, late referrals can cause a lot of problems, especially when we're dealing with conditions which can be life-threatening, like retinoblastomas, melanomas, tumors, no, potentially blinding diseases like glaucoma and corneal diseases, degenerations, which require early intervention. They should be referred early.
Yes, and in continuation to what Dr. Saptagiri said, I'll come to Reiki sir. Sir, the scope of practice of optometrists, has vastly, expanded over these few years. So I would like you to kind of, reiterate and maybe, throw some light on what is the role of an optometrist in early detection of these sight-threatening conditions like we have cataract, we have diabetic retinopathy, we have glaucoma. So how are they positioned and what is the importance?
Okay, that's a tough one thing. One is detection is based on your skill levels and your experience, your training, your skill levels, experience, everything counts into it. I just wanted to add a point to what Doc said earlier, which perhaps is relevant to this, is something that has worked for me and it's worked over the years. So I think what happens is that as your practice grows, your referrals to specific doctors, uh, maybe sometimes people you don't even know, but you know that they're sort of, you've seen some of their post-operative work and you say that, oh, this guy is really good at this and this is good at this. And you tell a patient, look, I've got, for example, let's say corneal. I've got two corneal specialists that I want you to see, and they go to a particular person whom you don't know. And I think the feedback from the ophthal to you would also make a bit of a difference. That maybe just a phone call to say, listen, you sent the patient, this is a little too soon, but I'm glad you sent it. Or it's come a little too late, next time send it a little bit earlier. So that sort of a feedback from the ophthal as to what his levels of comfort are when he receives a patient becomes critical. So again, as an example, uh, take for example a case of keratoconus, and let's say the corneal thickness is 500 microns, and I would always sort of say that, okay, I don't know whether this is plateauing out or this is going to progress further. So you do your necessary tests, and I would always refer to a corneal specialist because I would maybe speak to my patient and say, look, this is a corneal problem and you do need to see a corneal specialist eventually. Why don't you go there, meet him right now, log in your case, and then the corneal specialist would call me and say, look, right now you can hold on, you can wait for a while. We don't need to do a C3R. Let's follow up in 3 months or 4 months or as the case may be. And then he would also tell me, look, if it drops below 480, send it to me for a surgery. Or if it's a Fuchs case where we are also looking at a cataract simultaneously, he would say, let the vision drop to below 612 before we contemplate a surgery for both the cases. So you have a sort of a line, a Lakshman Rekha that is drawn for you by the specialist you are referring to. And you can actually manage the patient in the meantime. And because I don't like sending a patient to an ophthalmologist saying that, oh, why didn't you send it to me earlier? Exactly what Doc was saying. So I think in that way, pretty much the whole gamut of ophthalmology does fall into you as long as you're capable of recognizing the signs and knowing, look, this is not something that you're comfortable with. And yes, I think the position I'm in today, I'm maybe 3 steps ahead of what I was 20 years ago, where the slightest sign of something I would refer out. And the docs also have gotten fed up saying, don't send at this point. Wait for it to cross this limit before you send it to me. In the meantime, send it to the diabetologist, control his sugar, blah, blah, blah. So ophthalms are also extremely busy. They don't want to deal with simple cases. They want to deal with more complicated cases. So I think uh, you have to basically work your own systems out, but keep everything safe. What you would do in your own eyes, I think you should ask your patients to do. So if you have a slightest doubt, you're going to meet a corneal specialist or a retina specialist or a glaucoma specialist. Why not ask your patient to do that? You stand nothing to gain by keeping him on for 2 years more unnecessarily.
Yeah. So back to Sumati, ma'am. Ma'am, how important do you think counseling and rehabilitation in patients with partial or complete vision loss is? Like family members kind of give importance to that or giving importance to that.
It is very, very important because if one cannot see, then mind gets affected. In the sense like, their confidence comes down, their ability to do things comes down. Generally, their spirit of being in a state where they can function effectively comes down if their vision is affected severely. Not only for them, but also the counseling here is to cope with the loss or cope with the damage or cope with the inability, or I can't do certain things that I was doing now, I cannot do those kind of small losses or big losses, they have to be counseled because the mind gets affected. Why am I getting this at this time? Suddenly, some people have these conditions where they go stage by stage, they'll go blind, and they have to be helped to understand and cope with it. And a lot of compassion has to come in. And this is something that the optometrist or the ophthalmologist need to be equipped with. And I don't know whether that is being addressed in the academic courses as to how do you counsel your patients when they are having severe conditions. And so how do you prepare them? And that is a load on the doctors and the optometrists if they haven't learned how to do it. However, in the sense like this is, what do you know? I only know what I'm losing will be the line that the patient might be using. But while everybody need not become visually affected in order to give a counseling to as a professional to a patient, we need to be highly empathetic and go from the angle because people get scared because what is connected to a vision. That's the first thing that we do in 1 month. First milestone a child crosses in order for us to tell the world that I'm here. So the vision is very, very important. And that is, as I said, the gateway to the whole perception of the person, whatever their understanding in the whole world is because of vision. And if they don't have, that's another line of learning that they'll be taught how to do it. So when people are sighted, it's a gift. So this panel discussion is a gift of sight. So when we have this gift of sight and people have threats to it, the first fear will be what if I lose my vision? Will I become dependent? Will anybody care for me? Will I hurt myself? Will I be alone on others, especially as we grow older? These are the things that bother the people so much that they lose peace of mind, they become anxious, they become low. I don't want to use technical words like anxiety and depression, etc. But they do feel low, and one has to learn how to help them to cope with it. So maybe the gamut of activities that one can do in order to cope with whatever condition is there, like low vision, or that they are having something that gives them that blurry effect, or whatever the condition is. If the person has to cope with it, they have to be counseled, they have to be guided, they have to be given set of instructions, do this, do this, do this. And the optometrist or the ophthalmologist, whoever is guiding, whoever is counseling the patient, has to be given all the things that need to be done. You see, I'm a patient, I'm a teacher, and also a trainer for the field of eyes. They have,
Yeah, please go ahead.
yeah, and for my squint correction, including Reiki, I've been given a lot of instructions to help my condition, which I never did. I went and got all the equipment that they told me to buy. I went and kept it, but I did not do because it was very uncomfortable. Now nobody knows until I declare now. So, but I am only getting affected. But then I get into a squint correction surgery after that. But that is a very small issue compared to the big issues that people go through. So what people feel is fear of loss, fear of what if I lose. So then all the confidence that they have in them will go. We need to address that definitely.
Right. And last question is to Reiki sir. Could you please specify the difference between an optician and an optometrist?
And even I would like to know.
Yes, I think an optician is a person who actually, once a prescription is given to him, he knows which kind of lenses will help a person and the kind of frames that suits the person's prescription. Again, there is a cosmetic angle to it, which is a separate issue. But I think more the prescription, the type of lenses that are available, and with which he can perhaps give the person better quality vision, is what an optician's job is. Second job of the optician, I think, is to make sure that the prescription that has been given and the lenses that have been made are as per specifications. And that's your quality checking, I think, is perhaps a greater role today because earlier the opticians used to get the lenses and most of them used to do the fitting in house. But a lot of them today do the fitting outside by the labs themselves. And your job is really making sure that there are no prismatic errors, the centration is correct, the axis is correct, and so on and so forth. And that's when I find there is a huge lacuna today in terms of people who are qualified to do a proper QC. An optometrist, I think, to my mind, is a primary eye care practitioner whose job is to identify and diagnose conditions related to vision and eye health. And I think that's where, but again, you can put 10 optometrists in the room in India today and you'll get 10 different definitions of optometry. But I think your basic thing is to look after vision and eye health and know when to refer out and make the patient a lot more comfortable. And I think that's where we can excel at, where a patient, like extremely busy institutions, are very happy when they give vision to a patient. And I think our job is to do the last 5% where we make that vision comfortable. And that is by fine tuning certain things.
May I ask a question?
Yes, please.
I'm reading a lot of articles on AI's contribution to vision care. Any comments from both of you? What is the trend? How is this being incorporated? How is AI? I'm seeing articles, I'm seeing some explanations about how people who've lost their sight are helped by AI. So I want to know what do you both think about it?
I think AI is it is little bit strange because it also depends on which articles the AI is researching before they give a response to you.
No,
Sometimes it's
not
extremely
data,
accurate.
not that data. I'm talking about today with technology, you are able to, using AI, they are able to help somebody who is not able to see, use equipment, either as a chip in the brain or in the eye. Recently, I read in the retina, they place a chip. So, to that extent, the technology has evolved. So I just wanted to you both.
AI plays a role in this because this is really technology. Because they had implanted a chip on the tip of your tongue almost 20 years ago, which helped a completely blind person to actually catch a ball or see a moving ball. So this technology has been nascent. It is advancing, and I'm sure doctor will know far more about it than I would. but that is technology. AI is where you're actually using vast amount of data today to be able to diagnose a condition. So, for example, sometime back, I had a patient who went for a corneal topography. And in the 15 minutes that it took for them to come from the scan center to my office, they had an 8-page document saying which grade of keratoconus he's got, what are the various blood tests to be done, so on and so forth. I would say they were about 90-92% accurate. And there was, of course, a point where it said, in Chennai, these are the doctors you should see, which I completely disagree with because that was more an ad concept to it. So that's where I think AI is playing a greater role. And of course, AI is also powering tools to help you define uh, equipment. Like you can wear a pair of glasses today and you're completely blind, but the camera on those glasses feeds to a computer, which of course is trained by you to say that, oh, Sumati is approaching you. She's smiling, so she's in a good mood. She's wearing a red dress, or she's doing. So that is yes, those are devices which are coming out, which are definitely going to be very useful to us.
I was under the impression those devices use a lot of all this new technology and AI. The reason why I asked, because AI is not completely dangerous, it is also dangerous depending upon who uses it. It is a very potent tool. So utility is how we utilize something is very, very important. But what is the trend about helping people having very severe conditions? And how is technology, instead of saying AI or say technology, how is technology enabling vision care?
If you'd like to take this up.
Ma'am, the thing is, yeah, sure, Ricky. The thing is, what Mr. Ricky mentioned is that there are two different things. One is application of microtechnology for enabling vision, and the second is using AI. AI is, yes, as it's just an artificial intelligence in the sense that it uses that vast amount of data and it analyzes it in a very fast thing and gives you that right amount of what it thinks is right, it will tell you that. And that again can be changed over, it learns. So all machines have a learning. So it will learn that, okay, I made a mistake. Next time it comes like this is probably the right thing. So that is how it does. So we have diagnostic abilities in AI. Like for example, we have small apps which have AI embedded in them where if patients look at them, they can say, okay, you probably have amblyopia. You better see an optometrist and then an ophthalmologist. You have some issue with your color vision. So they're able to tell that, okay, this much amount of color vision is what you have. You better see a doctor. So things have come to that stage right now. But as far as treatment is concerned, they can help you with something. AI helps you with something, but everything else is technology driven. Right now, the brain chip and the retina chip surgeries, they're still, still very gross. They're not yet like proven for many conditions. They have been tried for AMDs. Uh, uh, One of our doctors from Shankaracharya long back, he left to US, and Dr. Rajat Agarwal was working there. And he was one of the people working for the brain chip surgeries, the retina chip surgeries. And they have made a breakthrough in the sense that you can understand something. Some gross forms are discernible, but it's still work in progress. I mean, they're working to make them smaller, much more efficient. There are also spectacle-driven devices which can tell you something about your surroundings, things like that. But there's a lot of see what happens is when you tell when an article is published that that glasses have come which will help a blind man to see. That's how it will come in the press. But so that then there's sudden flood of all type of patients coming into the hospital saying that I read this article, and now they're saying that we're all able to see. Patients with phthisis bulbi will come and say that there's an article that said that a blind man can see. So that is not possible. So things like that. So no, everything that is written about technology and the way it is going should be critically written that this is applicable for these conditions. Like patients with AMDs with very advanced diseases who are having this much amount of vision, only they will benefit with such an amount of implants, the retinal chip implants. So things like that. So conditions are very specific. The treatment for technology-driven conditions is very, very specific. Like let us say LASIK. LASIK cannot be done on everybody, but the general articles that come in newspapers and all, the LASIK you do, it's just sit in under the machine and immediately you come out without glasses. So what happens, they'll come, they'll have thin corneas, and they'll say, no, that article told that you will get it done, and that's when the arguments start. So, well, it's a long debate, but that's how the state of affairs is. So articles come, they get diluted. They think they get a LASIK done, everything is done for their life. Uh, it's not that simple. Things don't happen that easily.
Thank you.
So before we come to closure of this webinar, one comment from each of you, if you could give to the public one key message about eye care pathways and whom to visit when, what would it be? So yeah, Sumati ma'am, Dr. Saptagirish, and then Reiki sir.
You see, this instrument, this organ in our body is God-given. The power to see is also God-given. If I say God-given, people will say, oh, no, it's not everything, it's not God. Okay, it is a life force that is there which is making us see. It is each individual's responsibility to take care of this until we die. And when we look at it like that, if I want to take care of my eyes, today we are in a position where we have experts of different degrees, different levels, and technology, which helps us to have a better vision of the world and thereby vision of life. Because if we do not have the vision of the world, it affects our vision of life. And so when we have this organ, it is our responsibility to take care and not let anything outside influence our decision about taking care of it, because it is primary responsibility is the patient's. Educating them is the professional's responsibility. Family, of course, definitely is there supportive for us, like for anything. But we are in a good space where I have seen optometry grow as a profession. Like when we began, it was just a 4-year program, and now we have doctorates sitting all over the world, over different parts of the world, taking optometry to great heights, and thereby the support to ophthalmology is very immense, and I'm very happy to see the progress. And that's the reason why I have hope that the vision that the nation has, that every individual's vision is going to be taken care of, will definitely work, because the first line that was told to me when I started giving classes is ophthalmologists are very few, and there are so many people who have that to be taken care of. It's just not possible to give them the support, and some things can be done by an optometrist, which, when necessary, they will refer to the ophthalmologist, and thereby the vision care reaches a larger number of population in the nation where education, poverty, ignorance, indifference, and arrogance are there. It's magical that so much of care is being done. And when I hear about the camps that are being done in different schools, corporation schools, and government schools to create awareness, now everyone knows that somewhere we can reach a professional, an eye care professional. And that is what people like Dr. Saptagirish and Reiki and all have done working in this field. So I have hope that we will be able to reach that goal of improving the vision care in the country.
Thank you. Doctor?
Yeah, closing remarks, nothing much. It's been a wonderful session. Thank you, Paula, for having me here. And wonderful hearing to Dr. Sumati and Mr. Reiki. From my end, I just want to say that, optometrists are still the backbone of ophthalmic delivery system. Whether it's an individual practice or whether it's a corporate or whether it's any organization, the optometrist is the first point of contact for any eye patient that comes inside. So you should know your job well. Your refractions should be bang on. You should be able to identify basic conditions like which patients are actually having early keratoconus. You should flag it, because sometimes the ophthalmologist may not be, I not say may not be, most ophthalmologists nowadays will not know the nuances of optometry anymore. So it's unless you point out that could be, keratoconus, then the doctor will spend a little more time on the slit lamp, take a little more detailed view of the cornea and find out is there any other reasons. Spend a little more time on the K values, look at other details. So unless the optometrist flags it, some conditions, it will slip out, and diagnosis takes, you'll be missing diagnosis, you'll be missing problems. And things like how Mr. Reiki mentioned that if you can tell the ophthalmologist that patient was reading it too slow, taking time to read. That is an indication to the ophthalmologist that please send for a neuro opinion or something. There must be something else that is going on. So these are clues which the optometrist can always give to the ophthalmologist. And to the ophthalmologist, I'll say that don't neglect the clues and the cues that you get from your optometrist, because they were the first ones who spent the time with the patient. So when the patient was fresh to express themselves, it was optometrist sitting there. So things would have been much more clearer then, because by the time the patient comes to ophthalmologist after meeting optometrist or dietitian, it's already like 1 hour, 2 hours time is over. Patients are already tired. So they're not able to tell some things. They've already told you so many times, they don't want to tell it again. So these things can happen. So it is both ways. The care should be both ways, and both are equal parts of the wheel that care is given to everybody.
Thank you. Rekhi sir?
Completely agree with what Doc is saying, that it is an integral part of eye care. There are areas that do definitely overlap, especially in the private sector, where ophthals do a lot of the refraction part also. But I think if we can work as a team, and quite frankly, a lot of ophthalmologists today have encouraged people like me, and we work very, very well together. The only point that 2 points that I would like to make to people is that one, I think your first line of defense, as long as you're not in serious pain or injury, and you're just saying, "Oh, there's a slight blurry vision, etc.," is to see somebody as quickly as possible, be it an ophthalmologist, be it an optometrist. The second point that I would like to make is there are senior doctors like Dr. Saptagirish, like in Shankar Netrale, whom I'm exposed to, and Shankara, whom I'm exposed to a few people at an extremely top level. And I quite often feel that sometimes a person who's influential just says, goes there just to get a power check done so that he can read a paper because they have the ability to do it. And I frankly feel that is a national waste because it takes roughly 10 to 12 years for an ophthalmologist to be fully trained. It takes another 10, 15 years before he has great experience. And these are people who can give sight back to people from not being able to see. And to waste the hospital and this resource just for a simple headache or just a pair of glasses or a mild correction, I think is a national waste. And that's where I think we should channelize our efforts more effectively to contribute to the public a lot better. This may be controversial, but that's the way I've always felt.
If I may be impertinent to say, or a comparison, it is said you cannot escape the registration department. You enter when you are entering this world, and you make an entry when we exit the world also. These two are the times when we cannot escape the registration department, because at least 2 times we have to go into, our name will go into the department. So it's like, the registration department is very important for existence in this world. And so something like that, vision care, you first think of an optometrist. If necessary, go to an ophthalmologist. Can be a mantra that whole nation should be able to get an idea. Second, what both of them have said about reaching vision care, working in as a team, then the number of people will be served will be more. So first you go to an optometrist. So optometrists have to make themselves popular. So OCI has a lot of work to do that. Popular in the sense, not popular, celebrity popular, but they feel safe to go to an optometrist. So people don't have idea about it. So all that is much more important, because the technical training, everything is going very well. A lot of schools are there, a lot of hospitals are getting all this training. As this is a message that I would like to give the OCI, because your presence has to be now felt. Not, it's now 40 years. Doctor, this is 40 years since I've been hearing the story from batch one, and it's not comfortable now. Though we have optometrists have reached all over the world to doctorate level and all that, the profession hasn't picked up, and that is something that is all of you need to work on. As an outsider, as a person who's benefiting from that, I'm saying.
Point well taken. Yeah, so thank you so much. So as we come to the end of today's webinar, I would sincerely like to thank our panelists, Dr. Sumati, Dr. Saptagirish, and Rekisa, for sharing their time, experience, and valuable insights with us. Your perspectives have really helped break down complex eye care system into something easy to understand and practical for everyday life. A big thank you to all the participants who joined us today for actively engaging. Your participation made this session lively and meaningful, and we hope today's discussion has helped you feel more confident about looking after your eyes and understanding who to visit for the different kinds of eye problems and knowing when it's important to seek care without any delay. On behalf of the Optometry Confederation of India, thank you for being part of our ongoing efforts to spread awareness about eye health. Please stay connected with us on our social media platforms for more such sessions and updates. Until we meet again, take good care of your eyes. Do not skip regular eye checkups and help spread the word that getting the right care at the right time can protect your vision for life. Thank you and have a lovely evening. Thank you so much.
Thank you so much for the opportunity.
Thank you.
Thanks,
Thank
Paula.
you. Thank you.
Thank you for calling us. Nice meeting you, sir.
For listening to the two
Thank
of
you. Thank you. It's been a pleasure.
very nice, very educative.